Alright guys, M4M's quick dump on NPAs. This NPA is really common in the formulary nowadays for DoD. Most of the guys seem to be able to get their hands on them. Typically the old school fixed flange nasal trumpet is what we've all been trained on at some point or another. These newer ones that have the sliding ring kind of confuse some people. They're not sure exactly why this is set up like this, and really it's a depth measurement. So if you measured this on some average big barrel chested freedom fighter, it might fit perfectly, but if it's on a smaller person, you basically from the corner of from the nair down to the tip of the ear, you can adjust this washer and just slip it down, so now you're at the right depth. If the person was totally obtunded or unconscious, you wouldn't have such a problem, but if they're kind of semi-conscious or you're kind of bringing them out of some sedation or something, last thing you want is it to be too long, stimulate their gag reflex, have them vomit or anything like that, especially if an unsecure airway. And remember, this is just an airway adjunct. So big thing on that, this is what it's for. If you didn't know, now you know. If you did, good. So we'll try to blow your mind with something else real quick. Another way to use this adjunct is to take an ET tube adapter off an old ET tube, not a used one of course, but and slip it in here, and now you can carry this like this, and you can ventilate a guy. So if you had to do it in a pinch, you could hook up your ET tube adapter, ventilate with it if you didn't have your mask or anything like that. Pretty handy little trick. Would be good for assisting some ventilations or something like that. If you had a TIVA sedated patient you'd put down and you wanted to go ahead and assist with some ventilations or pre-oxygenate or something like that, you could go ahead and do this. So just another tip there. And then lastly, a lot of guys talk about they're not going to carry any lube with these. Some people like tape the packet of small KY jelly on there, which is a good practice if you got it, mainly just because it makes it go in a little bit easier. If the guy has a nose, it looks like a flat pancake and he's an MMA fighter on the side, you might have a little problem with NPAs, but typically if you just get some good lube on here and slide it down into your patient in a typical fashion, you're going to be good to hook there. A lot of people say, oh, I'll just use some spit from the patient's mouth or some blood or something and put it in there. That's alright, but your patient probably might be hypovolemic, might be dehydrated, so don't count on all that, and the last thing you want to be doing is struggling to get something in. Most of the damage that comes with NPAs is actually due to just the trauma going in, causes a little bit of bleeding. Typically when it goes in, it'll kind of self-tamponade off just against the rubber, and then when you pull it out after all that stuff's kind of dried out, you kind of break some of that stuff up. So if you got it, carry it, a little packet of KY jelly. If not, no worries. Just remember your tip for putting the ET tube adapter on there. We'll cover a little bit more on that in future podcasts, that type stuff. And then your slip ring here for size. Alright, M4M's. If you like it, let us know. If you don't like it or got something to add, let us know. And have a good one.